Welcome to YARKUD International. Today we are going to see the important Saudi Prometric exam question and answer discussion by the topic of medical and surgical. Okay, let's see one by one. First question. A surgical nurse is assigned to care for the woman who had undergone vaginal hysterectomy. The nurse performed assessment. Which of the following potential problems that the nurse should observe? Okay. So as I told before, if you read the options, all will be come. Okay, all the answers are correct, options are correct. But you have to be select the best one. Okay, remember that in your mind. Don't take just read it first option. Okay, it will become. So select that. No. Okay, you have to be read it carefully all the four options. So A is pain, fever, then C is anxiety, D bladder dysfunction. All will be there after the surgery. Yes, we know. So now we have to be take the key point. Vaginal hysterectomy. So what will be the all the patient with the surgical post-op, there will be the pain will be there, fever will be there, anxiety will be there. But here you have to look for the vaginal hysterectomy. Most common complication is the bladder dysfunction, because as we know, bladder, then the vagina, then okay, when then the rectum is there in the line. Okay, so now we have taking the hysterectomy means we are removing the uterus. So there will be the problem of that is cause the damage of pelvic autonomic nerves. Okay, so that will cause the sphincter problem in the pelvic floor. So that will cause the bladder dysfunction. So you have to think like that. You should not take the common answer. You have to select the best one. Okay, so here the answer is bladder dysfunction. You have to remember the complication of vaginal hysterectomy. Common complication, bladder dysfunction. Got the point? Take the key points and write it down. We'll see the next one. A nurse is assessing a patient who are becoming short of breath, easily intolerant of activity, and has a protective cough. The nurse noticed increased anteroposterior diameter. Okay, they have given the bracket barrel chest. Sometimes they won't give the barrel chest option. Okay, you have to be remember increase anteroposterior diameter. That is a barrel chest. Okay, the patient smokes 2 packs of cigarette a day. Which of the following diagnosis is most likely? This is the question. So option A is carpulmonale, B is lung abscess, C is emphysema, D is chronic bronchitis. Okay, all the options are it is about to lungs. Okay, here you have to be remember what we have to remember. There will be the patient with the barrel chest and through the anterior posterior diameter. Okay, anterior posterior diameter is increased. Okay, so what is the key point here? We have taken barrel chest. Barrel chest seen in which patient? Okay, that's why you have to always, when you study the disease condition, take the key point. Emphysema patient. Got the point? Barrel chest seen in emphysema. So all the related about the lung diagnosis only, but you have to select the key point. Barrel chest will be seen in emphysema. So answer is C. Got the point? Let's see then one more medical question. Patient with the brain injury resulting in the cerebral edema. Your ability to recognize cerebral edema early and intervene appropriately can improve the patient outcome. The nurse should be able to recognize signs, symptom, okay, signs and symptom and the medication which can reduce the ICP. Okay. So which one will be the reduce the intracranial pressure they are asking, okay, because the cerebral edema for the patient. So option A, Lasix. Option B will be the atropine. Option C is digoxin. And will be the option D, mannitol. Okay, so which one will be the, you have to be select the correct answer. So what is the action of Lasix? We know the loop diuretic and the atropine will be increasing the heart rate. It is the emergency drug. And what about the digoxin? Will be the cardiac contractibility drug. Okay, will be used for the heart failure patient. Mannitol. Okay, mannitol, what it will be do? Okay, you have to remember mannitol will be improve the cerebral perfusion and it will be decrease the brain volume. Okay, so what will be happen overall? The water content will be decreasing in the brain. There is a cerebral edema is there, right? So reducing that, we will using the mannitol to reduce the CSF volume. Okay, and decreasing by the water content will be decreased in the brain. So mannitol will improve the cerebral perfusion also. So it will be reducing the intracranial pressure. Got the point? Okay, CSF will be reduced and the brain volume will be reduced so that the patient will be reduced the increase ICP will be reduce the intracranial pressure. So what is the answer here? Mannitol. You have to know some of the important drugs action. So here the answer is mannitol. Let's see the next question. A conscious victim of a motor vehicle accident arrive at the emergency department. The patient is gasping for the air. They're extremely anxious and has a there is a deviated trachea. What diagnosis should the nurse anticipate? Okay, so all the questions are very big. So when you read the question, don't skip the key points. Okay, you have to take the key points. Motor vehicle accident and they are coming for the emergency department, gasping for the air, and there is a deviated trachea. So these all will be seen in which patient? So when you just see the diagnosis, okay, disease condition, when you learn, you have to take the key points. Okay, deviated trachea seen in tension pneumothorax patient. Okay, already there's a gasping of air because there is a draping will be there inside the air. Okay, so there is a tension pneumothorax. Suddenly happen motor vehicle accident. Maybe there is an injury in the lungs that will cause the tension pneumothorax. So answer is tension pneumothorax. Deviated trachea, it is a key point. Got the point? Let's see the next question. During the screening process for the tuberculosis, the healthcare provider noted that the patient received the bacillic calmette urine, that is a BCG vaccination several years ago, okay, when the childhood maybe. Which of the following is the best method to determine this patient TB status? Okay, now the TB patient is having the screening process. So it is related to community. Okay, healthcare provider noted, and there is a BCG vaccine taken by the childhood. So they are just now to do determine the patient is TB status. How they will do? What is the confirmation test? As we know, it will be the sputum culture. Okay, tuberculosis, you have to always remember sputum culture. So to confirm that diagnosis, we will do the sputum culture 3 times they will take. And one more thing you have to remember, so active TB patient after recovery, how you will be know the patient is not infected, that also confirmed by sputum culture. They will take the sputum culture 3 days. If it is negative, the patient is not active infection. Got the point? Okay. So TB patient will do the sputum culture. So these are the medical questions from the Saudi Prometric examination. There is a from the YARKUD International. We are giving all the nursing exam coaching online training available for the Prometric, SNP and MOH, DHA, HAD, OET, IELTS and Oman Pearson View nursing examination.